small particle matter that is in the air. So what should your lease include? Well, you want to define what you mean by smoking. What is it? In the state smoke-free workplace law, they've defined that as well. And then something that's on the horizon that you want to be thinking about is and I've talked with landlords who ban the burning of candles or incense in their properties, but you want to be thinking about the e-cigarette or the electronic cigarette. How many of you have heard of or seen e-cigarettes being used? Yeah, I was at a conference, it was a child capacity safety conference in Stevens Point in the fall, and in the session that we were giving, I noticed this woman just kind of take a quick hit off of something and put it back in her pocket, and after the break, I was like, I just had to go up and talk to her about what she was doing. And the e-cigarette is a pen-sized electronic device with a heating element that heats a liquid that may or may not have nicotine. We don't know how much it has or it doesn't have. It's not FDA approved as a cessation device, but this woman very much was adamant that it helped her to quit smoking tobacco cigarettes, and she was using this electronic cigarette to help her to deal with the cessation process. Not FDA approved yet. You may have heard, if you paid attention to the media this week, or the news, either aired media or a newspaper, that the Wisconsin smoke-free law, they were looking at whether they should allow cigarettes to be used in workplaces. I don't know that it's going to go anywhere in this session, but stay tuned, because the tobacco industry, just because we have a smoke-free workplace law and smoke-free places in Wisconsin, isn't going to let Wisconsin go. They're going to continue to look at how they can weaken that law. And of course, you know where I stand on including the e-cigarette in workplaces. We're dealing with that in the county offices as well, as we have some people who really want to quit. Is it a cessation device or not? I'm waiting until the FDA comes out and says it's safe to use. We have whole cities, the city of Los Angeles, just this week banned the use of e-cigarettes in, I think, restaurants or workplaces. So stay tuned. There's still a lot of information coming on e-cigarettes.
Do you, as a bystander, smell anything or sense anything from this?
It's water vapor is what it'll look like. There's a light. Well, it can have a light on the end, so it looks like it looks like it could be a real cigarette. There's no secondhand smoke that comes off the end of the cigarette, but what happens is the person inhales through the device, breathes it in, and then they puff out what looks like a little water vapor, like a smoke ring. And we don't know what's in that smoke ring. We just don't know yet, and that's why we're waiting for the FDA to rule. And I think last fall already, we heard from our partners at the state level, the FDA is supposed to be ruling soon. Now it's March, and we're still waiting. So I know government moves slow on purpose. Unfortunately, sometimes we have to wait a long time to get information. So getting back to the presentation here, you want to define what you mean by smoking in your lease. And if you ban candles, if you ban incense, whatever else it is that you want to prevent the use of in your buildings. I have a brother-in-law who is a heating and air conditioning building, and he is very adamant about burning candles in his home. And the soot that gets collected in the corners of the ceiling. And when he's at my house, and if I have a candle on the table, he'll be after me and say, "Paula, you don't want to be painting again right away, do you?" And so anyway, there's lots of leeway. You are the ones who make the decisions about what is allowed behavior in your properties. You want to describe where the smoking is prohibited, describe where it's allowed. You want to look at who has a responsibility. The guests should be notified, but by who. You want to look at how to deal with violations, where should violations be called into. You want to look at posting it clearly that your policy is smoke-free and what the enforcement policy is. What I found in my experience in working towards smoke-free workplaces is most of us are rule-following people. If you post it clearly, they know that smoking is not allowed in a certain environment, and smoking is promoted or is acceptable over there. I will think about the conversations that I had with someone from the Oktoberfest board when they wanted their beer tents to be smoke-free. And the thing that I really adamantly suggested was, make sure you post it clearly, because most of us will follow the rules. Speed limit is 55. Do I go 55 all the time? I wish I could say yes. I go 55 most of the time, except if I'm thinking about something else, and then I might go faster than that. But most of us are going to follow the rules if they're posted. And it's also self-enforcing with other people will say, well, this is a non-smoking area. I think if you aren't smoke-free currently, but you have common areas in your buildings, the place to start is You might not be ready to go smoke-free yet, that's okay. You need to develop and follow the process that's going to work for you. We already talked about e-cigarettes. They're not regulated, we don't know what the emissions are. They cause fires and explosions. They can charge like your cell phone charger, and there's been a fire in the area where the charger plugged into the wall overheated and caused a fire. There was a man in Florida whose e-cigarette, when he was smoking it, exploded. I'm not willing to take that risk. I have a teenage boy who I found that when I filled up the van with gas, I found an e-hookah. A hookah is a whole different kind of delivery device of tobacco or TVs or whatever it might be. But I found an e-hookah wrapper in the van when I filled up the car with gas, and I had a conversation about that with him. What are you doing here? We've talked about this kind of thing since they were, little guys. Anyway, I digress from the topic at hand. So, and smoke-free policies just apply to new tenants. I remember a few years ago when the Housing Authority Conference was in La Crosse, and this was just first rolling out, and we had lots of Housing Authority organizers talking about grandfathering in residents, thinking about older adults in high-rise buildings or older adults in other buildings, and you think about, well, they're 90 years old and they've been smoking for 40 or 50 years. Are you going to make them suddenly not smoke in their apartments? What we found is that grandfathering can lead to difficulty with compliance. Because of the seepage of air from one apartment to the other. I think one of the statistics that I had seen is 60% of the air in any given apartment is recycled air from the nearby apartment. Because of that, if you have 3 apartments on one floor and the middle one is a smoking apartment and the other 2 are not, the air migrates from apartment to apartment. And so you want to really think long and hard, I think, about grandfathering in tenants. I think there's confusion among tenants. Well, why does, Joe Smith, who is 86 years old, why is he allowed to smoke in his apartment and, and I'm, new to this building and I can't smoke in mine? You want to treat everybody fairly, but I think if you're going to make a change in policy, you want to give enough notice to make it fair and equitable. It's kind of like before the smoke-free workplace law when buildings or businesses wanted to adopt smoke-free policy. Well, you don't say, well, we're going to go smoke-free next week. You talk about the whys. You talk about the savings benefit. It might be insurance. It might be health-wise. It might be cleaning-wise, whatever it might be. We're going to talk about what's in it for you as a property owner manager, what's in it for the tenants, and then come up with a compromise on implementation. You might wish you were smoke-free January 1st. And it's March now, but if you talk with your tenants about their interest and their support for it, you might come up with something. And then the other issue with grandfathering and the confusion among tenants, I think, is that because most work sites are now smoke-free, or all work sites should be smoke-free, hospitals you can't smoke in, lots of our nursing homes have adopted smoke-free policies. It's getting to be pretty common standard operating procedure that people aren't smoking in many other environments, and so they learn how to cope. Maybe it propels them to think about quitting. Maybe it supports them to get, look at other resources that are available to them for support. How do you ensure compliance? Well, I talked about some of this. I'm like one of the presenters earlier today. I'm talking about my slides before they're up there. I think you get plenty of notice. You make sure you post signs. Your residents can be your greatest allies, and that they will help you to, I think, with the enforcement and with the adoption of the policy as well. I think you actively market your buildings as non-smoking. We've had a couple landlords, one of them is here today, who is posting up one of our big banners on his building to let prospective tenants know that they're smoke-free. We've had a couple others that have opened their buildings smoke-free. Those were new buildings that were just being built and constructed that are opening smoke-free. But I also think if it's something that you're hoping to change, and I've been talking with some landlords and talking about the moving out routine. Maybe that's a time when you have a lot of leases ending is a new time to think about implementing it. Again, it's all related to what's important or what fits into your business plan. And I think the other piece of that is you enforce this policy as you would any other policy that's in your lease addendum as well.